Después de revisar los resultados de las pruebas, usted tiene diabetes tipo 2. Me gustaría que empezara a tomar unos medicamentos y también tiene que cambiar su estilo de vida. No puede comer las comidas que le gustan y tiene que hacer un montón de ejercicio. No me pregunte nada, no tengo tiempo, chao. Whether or not you speak Spanish, what if that was one of the first medical encounters you had after moving to a new country or even after living here in the US for a period of time? What did that information sound like? What was the tone? Harsh, mean, lacking empathy? What if I told you that many Spanish dominant speakers in the US receive subpar health care and have worse health outcomes as compared to English speakers? Research shows that less than 10% of all healthcare workers in the United States identify as Hispanic or Latino, and the number of Hispanic physicians would need to double annually for 92 years to reach the parity of representation in the US population. Preliminary research also shows that in 2019, 14% of physicians said that they spoke Spanish, but it was unknown what their proficiency or competencies in the language were. So why does all of this matter? Well, because Spanish is no longer a foreign language. It is a domestic one. And we know that when patients receive language concordant care or health care provided in their preferred language, they have better health outcomes, they're more satisfied, and they're more likely to follow a treatment plan. Oh, and by the way, it is a right to receive health care in your language of choice. And this dates back to 1964 and the Civil Rights Act, and several government mandates since in 2001 and 2016. All of this information tells us that it is imperative that we have linguistically and culturally competent healthcare workers in the United States, which is what my research aims to do. We are developing evidence-based longitudinal curricula that will train future healthcare providers on the Spanish language and cultural competencies needed to provide quality healthcare to patients who prefer the Spanish language. And there are many parts that go into this. We're looking at the language structure itself, proficiency levels, cultural competency and understanding, language tasks and functions, and so much more. Many people assume that you only need to know the language so that you make sure that you tell someone that you're embarrassed and not pregnant, a common false cognate. But the language goes deeper. Other false cognates include intoxicado, which looks and sounds like intoxicated in English, but actually means poisoned in Spanish. Or, for some Spanish speakers, sciatica refers to generalized lower back pain and not sciatic nerve pain. Or another story I was told was when a patient who had requested an interpreter and was refused one thought that he had received a cancer diagnosis. He mentally prepared himself and he went in for a procedure shortly after the diagnosis, thinking that the doctor was going to remove his cancer and he would then start chemo and radiation. His son, who spoke English, went with him and found out that actually cancer was never discussed. And it turned out that the surgery then was not to remove cancer, but to remove a benign tumor in the bladder for better functionality. So yes, language is a crucial piece to healthcare, and cultural competence is equally important. Language and culture together tell us about politeness, formality, tone, silence, body language, and so much more. And this is the essence of communication. The subtleties and intricacies of language and culture help us understand the stories behind the words and the emotions behind the expressions. Now, recently I've been asked about why is this work important in light of technological advancements like Google Translate, artificial intelligence, and everyone's favorite, ChatGPT. Well, did you know that Google Translate is at maximum only 58% accurate in medical conversations? Would you risk not understanding 40% or more of a medical conversation? And we know that these topics are tough anyway, let alone when there's a difference in language. We don't yet know AI's accuracy, right? Because it's too new and studies haven't been done. But as we experiment with it, we do know that there are severe limitations. It has bias, it discriminates, and it even hallucinates to make up answers when it doesn't have all of the information. And so we must think about why we learn a language. So think for a second. Why are you learning a language, or why would you learn another language if the opportunity presented itself? Most likely, it's because you want to have some sort of relationship with another human being. Maybe that's through a friendship, maybe you have family that speaks another language, or maybe you want to speak directly to your patient in their preferred language to build trust and empathy. We have to remind the world and ourselves that connection, belonging, empathy, emotion, these are what make us human. We express these notions through language, and the expressions are deeply rooted in culture. The essence of communication goes far beyond outputs and statistical predictions from technology. Language and the human experience bind us together. They underlie our cultures, histories, and personal experiences. Genuine human connection is at the heart of true language and cultural comprehension and expression, something technology cannot replicate. And that is why we learn another language, for connection and a sense of belonging. And because of that, we can see that language is not simply a bridge, a way to get one message across and back. But in fact, language is one of the most crucial parts of being human. It changes lives. It saves lives. Language is a lifeline. Thank you.